Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, or naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So whether you're a fellow dental professional, a wellness enthusiast, or just someone curious about a more natural approach to your health, you're in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
All right. Today we have joined with us the founders of Mouth Lab, which is going to be a super exciting conversation.
I know. I think this is the first time we've had two guests on the podcast at the same time. So this is exciting. We have Jazmin Platero is the co-founder and research director of the Mouth Lab, a biology-first oral microbiome company based in Colorado. With a background in research and science communication, she is dedicated to changing the way people understand their oral health and its connection to the rest of the body. She works alongside clinicians and patients to make the science of the oral microbiome accessible, actionable, and impossible to ignore. And then we also have Angelina, RDH, BSDH, and fellow biological hygienist, HIAOMT. She is a biological dental practitioner, clinical educator, and researcher with more than 2 decades of experience at the intersection of preventative care, periodontal health, and oral systemic science. She is the co-founder and clinical education director of the Mouth Lab. She is a practitioner-driven research and education collective advancing the clinical application of salivary diagnostics, oral microbiome science, and the systems-based periodontal care for dental and medical clinicians. Her work focuses on developing biological hygiene protocols and repeatable clinical framework that has helped practitioners interpret salivary DNA data, understand microbial patterns, and communicate oral systemic risk more effectively within everyday practice. Angelina is actively engaged in clinical research exploring oral microbiome modulation and periodontal inflammation, and is a member of the International Academy of Oral Medicine and Toxicology, as well as the American Academy of Oral Systemic Health. Ladies, welcome. Thank you for the work you do. Those are some great bios.
We're excited to be here.
Yes, thank you so much. We're excited to just talk all about the mouth.
Perfect.
This is going to be a fun conversation because it's my jam. So we have the Mouth Lab and Saliva Sleuths.
Yes, totally.
Awesome.
Here.
It's so exciting. To get us started, let's talk about the Mouth Lab. What inspired you to start the Mouth Lab? What is it? What are you guys doing when we're talking about the Mouth Lab? Lay it out for us.
Ooh, that's a big question. What is the Mouth Lab?
So I started in traditional dentistry, so I wasn't always a biological hygienist, but the Mouth Lab was born out of frustration because when you're practicing traditional hygiene, you, instead of going towards a healing model, you keep telling your patients do the same thing, brush, floss, rinse, and you're just really monitoring them while they're getting progressively worse. And as a clinician, that's very disheartening and it's frustrating for patients as well. And you get burned out. You just don't really want to tell them that you don't have the answer. You don't know how to fix them.
Floss better.
Yeah.
Yeah.
And then you accuse them of lying, right? And they're like, I am flossing. No, but it was born out of frustration, and I wanted something different. I wanted something that could help patients actually get better. I wanted to see those improvements. When I had got out of hygiene school, I was so excited because I was like, great, I'm going to go out there and change the world, and we're going to get rid of gingivitis. And little did I know that's not what was going to happen at all. And so when I started searching for something different, the biologic approach really made sense because we were looking at root causes and looking at more than just what we could see, what we could scale, what we could measure, the pocket depth. And that made a difference for me clinically. And it made a difference for my patients. My patients felt better. They weren't getting that same failing report card every time they were coming in. I can actually give them some good news, and that is rewarding. So that's how the Mouth Lab was built in a nutshell.
Yeah, totally.
So many things resonate, right? We graduate from hygiene school and we think we have all the answers to gingivitis and cavities, right? Like just brush and floss and paint some fluoride varnish on there, and that will solve all of our problems. And if only it was that simple.
And I feel like also the mouth lab began also out of patient necessity, like patients coming to us at the end of the road, having already tried everything, still not improving, and what is next? So that pushed us to also continue to educate ourselves more and continue to dig deeper into the problem to figure out what that root cause is, because our patients, they want those answers. They need those answers, and nobody's listening to them or giving them these answers.
Yeah, I think that's an important point. A lot of times patients don't feel heard when they're like, I got this bleeding spot in my gums, or I have this spot that's consistently bleeding when I'm brushing. The typical answer that you would get would be like, oh, you just need to brush better or floss better, or let me throw this rinse at it. And that's elementary. Like patients know that's what they have to do already. But if that's not solving if that's not solving the problem, we have to look a little bit deeper. And so that's part of the reason that we started implementing salivary testing, because we wanted to see what's actually going on in the mouth. Like, what can our saliva tell us that I can't just see with my eyes? And little did you know, once you start basic salivary testing, it's going to lead to more testing, different tests, more questions, maybe before you get the answers. But eventually you will get to the root cause. And that's what we found.
So you guys are in Colorado, and you have a unique setup because hygienists have autonomy in Colorado. So tell me a little bit more about how you're practicing, because this is, I will say, the hotbed for hygiene right now. Is there are hygienists that are so ready to have their own practice and be this next level. And just in reality, there's hygienists that will never step outside of their comfort zone and want to stay with what they learned in school. And hey, that's fine. There's something out there for everybody. But I want to know more for those hygienists that are looking maybe to start implementing salivary testing, or maybe they live in a state where they're able to do practicing on their own, have that autonomy. What did that journey look like for you guys?
Yeah, it's definitely a long road to get here.
Yeah, I think whether you're working independently or you're working with a dentist, when you're thinking about salivary testing, it's one thing just to do the test. But if you don't change any of your protocols or your treatments with the knowledge that you gain, then the test doesn't really matter. You don't really need to do the test if nothing's going to change. And so that was when I was working in a practice with a dentist, that was one of the biggest hurdles that I had implementing salivary testing, because he would tell me that, what does it matter if I know what bacteria are there or whatever other parameter we were measuring, because nothing's going to change. And that's not what I wanted to do when we implemented testing. But little by little, if I kept nagging at him, finally I got my way and started implementing testing. And it opened up more questions. We started testing blood leukocytes and proteins. And when we were doing that, then I was like, okay, what's causing these? What's causing these biomarkers to be elevated? So we needed to know. And then that led us to more microbial testing. And so for a lot of patients, once you know the microbial makeup, then you can actually make some meaningful changes.
Yeah, like piece the whole picture together with their health history and their dental history and now their microbial picture. It really starts to kind of paint this nice picture.
Yeah. And even their blood chemistries or their stool tests, their nitric oxide. There's a lot of different things that come into play, and it really turns dentistry from a one-size-fits-all model to an individual care model. And that's really what we're shooting for, because nobody's bodies are the same. We're different in every single aspect, from our salivary makeup to our fingerprint. It's everybody is extremely different. And so we have to take that into consideration when we're putting our treatment plans together for our patients. And not only what we're doing in our office, but the communicating with the patient's physicians in every other aspect
Yeah,
of their
very
systemic health. Because once all those puzzle pieces come together, then you have a better idea and can make a better treatment plan overall for the patient.
Love that. Love that. Heather, I'm sure you have so much to add to that conversation, so I'll just let you start.
Yeah. It's magic when we start getting to the root cause. And sometimes when you start getting into the salivary testing, you can start pointing out. I've had a few different consults this week with bristle because this is what I teach on the bristle side of things. And then I have saliva sluice, and we dive into the root cause and what's going on based on salivary testing. I really want to learn more about what other testing you're doing and where our scope is, because I know that's been one of the questions that I'm careful about because there's so many people who ask about licensure and are you able to test the gut, and are you able to do the hormone testing and the proteins and the vitamin and mineral testing? Are you staying in your lane? What about your licensure? So I would love to know what testing you're doing outside of salivary testing, what salivary testing you're using, and what do you find are the connections? Because I teach the practitioners who come into bristle, I teach the triangle. Like we've got the airway, the gut, and the mouth. And it's really hard to push the mouth. If you're having a hard time pushing the salivary test scores in the mouth, then we've got an underlying inflammatory problem somewhere else or a mineral and vitamin deficiency, or an acid problem, or a pH problem that we have to address. So you can't just think that you're going to slap like you said, rinses or get someone to floss more and push the oral microbiome if you're not looking at the terrain of the patient, right?
Yeah. So
What?
I'm no professional on licensure and like each state of what's allowed and what's not allowed. But I think that's why it's so important to make sure that you're collaborating with your other medical professionals. So if you do need some of those tests that maybe you're not allowed to order in your state, that they can order it and you guys can work collaboratively to see how they are affecting the patient systemically and in the mouth. Like a lot of times the practitioners that we work with will order stool tests, and a lot of the oral pathogens, if we have a patient that's highly inflamed, those oral pathogens will end up in the stool. And so those are important things that we need to address, because those oral microbes should not be ending up on the other end. And sometimes patients feel like it's weird, like, why is my hygienist asking about my stool test?
Yeah.
But it's really important. And I think we were using SILHA before, and so that's where the blood leukocyte and protein is on there. It also shows pH, buffer capacity, and one more I can't remember, caries risk, I think, some sort of bacteria. But those are like gateway. They're not diagnostic tools, they're screening tools. And so if we screen for those, if we see those inflammatory markers are high, then we can say, hey, do you know about this? Have you had other blood chemistries with your physician? Do we need to do additional salivary testing? There's lots of avenues to go down, but it opens that door. I think oral genome offers something similar with the
MMP.
It opens the door, that way you can begin to talk and have these conversations with your patient, because if you just bring it out of the blue, it can be really difficult for hygienists to make that transition.
And I think it goes back to the biggest takeaway, and one of our biggest core beliefs, obviously, is that the mouth is incorporated with the rest of our body. It's the start of your GI tract. It's literally at the forefront of everything. It's a front door. And so it's very important to make that connection. And I know we have heard a lot about the oral gut connection or oral systemic connection, and it's so much more important than people realize, because once you start to see the mouth as part of the rest of the body, it eliminates those questions of how is this lab connected to the mouth? Everything is connected to the mouth, right? How is a stool test connected to the mouth? You can talk about the gut tissues of your gut barrier. mimicking the same as your gingiva. Like all of these are parallels and connections that, again, you really can't ignore.
Ooh, I have a really cool case that you guys might be interested in.
Oh, yes.
I didn't
Bonus.
know about this. So we had a patient come to us. We didn't order any of his labs. He had brought them to us. And this guy had a pyogenic granuloma, which I was really interested in because we normally see those in pregnant women. So I'm like,
Right.
all right, all my years practicing, this is the first man that I've seen with the pyogenic granuloma. And the reason we knew it was because he had a biopsy. And so we had the official diagnosis. And so I'm like, oh, so we start looking at his labs, looking at his stool test. Turns
He
out,
didn't want to get rid of it. He didn't want to have it excised.
yeah, so that was the recommendation, which it normally is surgical excision. Refused to do that. He was a young guy, probably in his 20s, late 20s.
Mid-20s.
So we start looking at his stool test. Turns out his beta glucuronidase. I can always have
Gluconic.
beta glucuronidase was elevated. And so what that means is your body has a difficult time removing estrogen. So his hormones were all out of whack and he had a hard time detoxing. So we get him going with the detoxing, send him back to his practitioner. They get the hormones under control and starts shrinking. And I have to follow up with him still, but it was like pretty much gone.
And that is like such a great case to highlight just how connected this system is. Like his hormones were causing this issue that eventually ended up in his mouth.
And I
is
just
so
kind of tie
interesting.
that in his salivary test. Did he have a lot of Pella species, just out of curiosity?
I don't remember. I think he just had
Okay.
TF and FM
Okay.
were the
Ah.
high. I can't remember specifically. He actually did have a bristle test.
Oh, okay. So
Yeah.
on the back side of the bristle test, I did a whole deep dive on hormones, and estradiol or estrogen, those can impact the virulence factor of prevotella. So they'll grow more, and then some of them are very pro-inflammatory, like Prevotella melangenica will become more virulent with the presence of that estrogen, which could be the driving factor for that granuloma.
Yeah.
It's so wild.
Those are like the fun cases. That's what we want to see, right? That's what we want to do. Let's get to the root cause of this stuff. So fun.
Yeah.
Because what is the opposite side of that? Like you said, had he not said no to having that done, they would have never caught that his
Come back.
estrogen was high.
Yeah, it was just gonna come out.
Yeah.
That's so wild.
Interesting.
That makes so much sense with the pyogenic granulomas now. Like that is so interesting. And obviously something I'm going to take away if I see another pyogenic granuloma, period, man or woman. But obviously we know definitely on women.
It's hormone. Yeah. Very cool.
Interesting.
And you don't think of men having that as an issue, but we do have a lot of endocrine disruptors in our environment too that are severely impacting. And some of the medications are getting into the water and impacting some of that hormone component within men and women, which is, it's interesting. That's super cool. Thanks for sharing.
Not tangent, but I was just like, oh, that's just neat.
No, that's a good tangent. Just
I
a
know,
note
now
on
I'm
the
a rental test.
just a note on the licensure thing, the testing, can we not? I think it only becomes a legal issue if there's a diagnosis, because you're not diagnosing. It's the same with like hair tissue mineral analysis, the salivary diagnostics. Like these are things that are direct to consumer, like a patient can order them. It's the issue is when you start to diagnose based off, not treat or help balance things, but the diagnosing for whatever reason.
There's lots of tools, lots of tests out there, depending on whatever the patient needs are, as far as even vitamin D testing or
Right.
mercury testing to see if you have a high level of mercury in your body. So there's lots of different tools that we can pull from to help make the full picture and
Absolutely.
crack things, cases like these, which I think is super cool.
Definitely.
Yep. It's fun. I just did a consult with someone and her oral microbiome looked really great on the front side of the test, but there were a few things in the back that I was like, These could be pro-inflammatory, lipopolysaccharide outer layers, driving inflammation. She's mast cell-ish with hives and things like that. And there were a few other species that aren't normally found in the test, and one happened to excite neutrophil responses. So I was like, there's nothing that we can diagnose here, but you do on the front side, the typical pathogens like treponema and PG, and those aren't present. But on the back side, we have some species I don't see very often, like Pseudomonas, and there was one special one that I had to look up because I was like, never seen that one before. So when I looked it up, it was like activation of neutrophils. The neutrophils drive that long-term inflammatory issue in a lot of people. So then I'm like, okay, so this might be something worth taking to your functional medicine doctor. Start working on some gut health components so that we can work on reducing. It gets really challenging to even think about. I know sometimes, I'm sure with practices, I'll get like emails like, how do I just reduce FN? We can't target one specific species. Like we look at the environment, like that specific species that I found that can drive neutrophils, gram positive, but it was an anaerobe. And I'm like, okay, in a really simple aspect, maybe we need to use a little bit of ozone in the picture to not wipe out completely the front side because you're balanced there, but maybe adding some ozone in and then working with your functional nutritionist. And of course, I said, you got to get a gut test if we've got some mast cell stuff going on. That's saying we've got some gut stuff probably happening. Maybe some of those bacteria on the backside can be translocating and implemented, especially because you had some unique ones back there that I don't see very often.
I think gut testing is so valuable. I think a lot of people have gut issues before they even realize that they have gut issues. And maybe even gingivitis is the first sign that, hey, you have gut issues starting. And I know most people don't really have gingivitis before they have it, but they sure do see their dentist, or they should see their dentist more often than they do any other physician. And so we're on the front lines. If we see a little bit of bleeding, it's not just a little bit of bleeding. Those are the first signs that, hey, you have inflammation going on. Those bacteria are going straight into that bloodstream. And if that junctional epithelium is broke in your mouth, then those tight junctions in the gut are probably looking the same way or similar. And so it's a real good sign for us to say, okay, we got to do something about it now before these symptoms get worse.
Yeah.
The mirror too, I think another thing, like with salivary testing, I teach all the time, like we can either have the bacterial component driving, or we've got some other inflammatory issue going on somewhere else, and sores in the mouth, for instance. If you look at ulcerative colitis, the first place the sores start showing up is the mouth. So maybe it's not an irritation or bacteria in the mouth that we're seeing, and it's causing those ulcers or a traumatic ulcer. If someone's like, I've got a mouthful of sores, I'm like, okay, we probably should do some gut testing because ulcerative colitis shows up as sores in the mouth.
Yeah.
Yeah.
And a lot of nutritional deficiencies too, like vitamin C deficiency. You can see those
Geographic
symptoms.
tongue.
Geographic tongue, colitis. Like a
Or
lot of
regular
people-
colitis. Yep, you just said glossitis. If your tongue feels too big, I've had some people, when you get them straightened out, they're like, my tongue fits in my mouth now.
I'm so excited for Lainey Macbeth's book to come out.
Yeah.
Of her tongue course. I'm very excited for that one.
Yeah.
Sorry. Okay. On the note of protocols, you were alluding earlier that traditional protocols just felt incomplete. What felt like it was missing for you?
Do you want to take this one or do you want me to?
Go ahead.
I guess what felt missing was that we weren't looking at the bigger picture. We do the radiographs, we probe, we see if there's any bleeding, and then we jump straight into a procedure. Even though a lot of times, or every patient should have a health history form filled out, a lot of times it was just like glossed over and not really looked at. And so even though those were the standard of care, or they still are the standard of care, we really weren't looking at the bigger picture and incorporating that medical history and seeing what the patient was actually telling us in that form. And so I think when we have a really good medical history and you have really good conversations with your patient, all of a sudden your eyes open and you're like, hey, I can actually see this patient through a different lens than just like cookie cutter. Because a lot of times patients will present the same. You have one patient, the tissue is nice and firm and pink and tight, but they still have 4 millimeter pockets, or that gingiva is still tender, or once you stick your probe in there, it's bleeding. Or you'll have another patient where they're red and swollen and inflamed. They have the same 4 millimeter pocket, but they present totally different. And those are two different stories, but clinically you would treat them the exact same. And so that tells us something when you have patients where on paper they look similar. Their treatment may be very similar, but two different things are going on in their bodies. And that's where we needed to do the deeper dive, dig in deeper. We still do the same debridements. We're still doing the same metrics as far as traditional dentistry, but the testing really adds an additional layer, an additional lens where we can customize treatments, whether it's diet, lifestyle, probiotics, lasers, ozone, whatever the case that we're doing, but we can target specifically. And it's not always a microbial issue like we were talking about. It's an inflammation issue, it's a barrier issue, hormones, viruses. There's a lot to take into consideration. And I think that's really what's changed a lot for us.
And the way that I always like to portray this to our patients is, let me ask you this. When was the last time you went to a doctor and all they did was look at you and said, you look good, we'll see you next year? And so why does the same thing happen in dentistry? So doctors, they will run blood tests, they will run all sorts of labs to figure out what your body is saying. So why don't we do the same in dentistry? We look at your teeth, we examine everything that's physical, but there's no second step to discover what's driving all these things in the background. So just like in medical practice, where you run diagnostics, I think it's important to also bring that into the dental world.
Because insurance doesn't cover it.
I know.
That's why.
That's a huge pain point for patients.
Everybody, providers and patients, because we see, and I would even say there's probably more providers out there that if insurance did cover it, they would probably run a test, a salivary test, 100%. And I think maybe even if there was a little bit of coverage from insurance, you would probably see more patients go for it. But 100%. The things that we miss.
I think
Yeah.
we have to, even though insurance isn't covering it, I think it's still our patients. It should still be offered as a choice to patients. So the patients that do want it, they can invest in whatever the fee is, because at the end of the day, the insurance doesn't care about their health.
Health savings does kick in. So I know Bristle, you can get your health savings. So as we have those conversations with our patients, many individuals have a health savings account or a FAFSA, not FAFSA,
It was like college pre-application for financial aid.
and what, a FSA account?
FSA.
Sorry. And then you can plan ahead, and you should be testing and retesting to know where your treatment's taking you. So there's advantages to doing multiple tests. So if you have the conversation up front with individuals and teaching doctors how to have that conversation, hey, this is what we do in our practice, and it's more insightful for us to understand the pathway of disease on what we're seeing. We can plan ahead, and you can save the money in your health savings so that we can have you testing and retesting. The cost is going to be this. Next year, make sure or plan ahead. So we can have
preventative care is much more affordable than restorative care. So if we can get ahead of it, it's a small investment for a long-term payout.
I feel like that's the piece that a lot of people miss, is the expense today may avoid you the greater expense down the road. And it really is about patient to patient, because some patients really are desperate for those answers, and they will do anything that they can to figure out and get to the root cause of things. And patients that have immune disorders or anything like that, they are wanting to go down that road and they want to discover this. And hopefully one day insurance can back us up on this. Maybe that's part of our mission. But I think it's, regardless, like Angelina said, it's important to offer that to the patient and for them to have the option into figuring out their microbiome.
Yeah. I think in the conversation of health, there's health literacy, right? Like patients only know what they've been taught. And depending on what their background was, they may or may not know very much, or just something may not be on their radar. I went to my optometry appointment this morning, right? And I am just like, I just want to make sure I'm not going blind. I want to continue to have good vision. But he actually asked me a question. Is there any concerns you have or things that we need to talk about? And I was like, you tell me. I don't know what my options are here. I just want to make sure I can read those letters up there better than last year. That's my goal. And I think you make a very good point. Patients don't know what is possible. And I think clinicians, we do get uncomfortable asking for money, right? We take on that burden so much. But we never know what a patient is or is not going to do if we don't give them that option. They don't know, because there's so many providers out there not having systemic conversations, that we could be that first person to introduce an idea to them. And it's frustrating to be that side of it. It's frustrating to be the seed planter, because you're just like, I just want to see somebody follow through with this. But maybe maybe on their algorithm, they'll start to see an ad for something that'll talk about oral systemic something else, and it'll just make them think. So there's so much work to be done out there with oral systemic marketing, just with functional health, biological health, all of those things, that what we have known for the past 50 years, hey, this doesn't have to be the same as what our parents did or our grandparents did. There is more that we can do. We're not stuck in that same system.
Yeah, hygienists a lot of times feel like they don't want to sell dentistry. And the way I look at it is, I'm not selling you anything other than health, because if I don't give you the option, then you don't know about it. We were doing some marketing for the mouth lab and looking for practices to partner with. And one of the practices we came across, they literally told us, if patients are getting better, how are we going to make money? And I was shocked.
Lord.
I was like, isn't this why we got into this field, to make our patients
feel
better?
people? Yeah.
But apparently
No.
that's the case for everyone. So
Wow.
as at the Mouth Lab, we truly do want our patients to get better. They may not be our patients forever. If they find the magic pill and they get better, then they don't need our services anymore, then great. But there's plenty of people out there to help, and we don't need to find treatment to make money. It will come naturally, and I don't believe in overselling anything to anybody that they don't need or want. And I think that's really important, is finding the best practitioner for you that has the same values, that is interested in actually making you get better, feel better, function better, because apparently that's not everybody's goal. And maybe I was naive to that, but I really thought that everyone was trying to make their patients better, but
Yeah.
apparently not. Little to say, we did not
No.
wind up partnering with
Yeah.
that practice.
No, and I think that is a kind of a pattern that you can see a lot in traditional dentistries, where we have been doing things the same way for so long that nobody has thought to think outside the box and think beyond what is possible within what we were taught. Specifically, that same office, the person we were speaking with, they said, nobody taught me how to do this. I just picked up whatever the last person was doing and I just did it. Their front desk staff. But I think that's where a lot of the times we get stuck and we don't come to that realization moment of, what I'm doing is not working. Let's pause and let's figure out what other tools are available for me to actually help this person. I think that.
Yeah, and I think that's good for patients to kind of realize too. If you're going to a professional or anything and you're looking for different results, but you're getting the same result over and over. I have a cavity every time I go to the dentist.
When
I
have
have-
we ever stopped to think?
Yeah,
That's
something's not working.
wrong.
Or I have bleeding gums every time I go. Whatever they're telling me to do, it's not working. I need to figure something else out. And that's exactly where personalized care comes into play.
And it's applying, going back to school. It shocks me when periodontists are, what's it going to change? Like, why would I test? I'm like, out of everybody, let's go back to periodontology. What are you treating? I just had at Chicago midwinter, I was hanging out at the Hygienics booth, or actually it was Periodo DT. And I did a social post and a girl came up and she was a younger hygienist and she was like, oh, do you have samples of this? And he was like, no, we're not giving out samples. And she was like, isn't this the stuff that gets rid of calculus? And I looked at him, I was like, can I have the conversation?
Right.
But calculus, it isn't the root cause of the issue. Like, we want to remove the calculus, but it's about biofilm disruption. It's about the pathology that's present and the disruption process. So yes, this is absolutely going to help you with calculus removal because it's desiccating and drying out calculus. So it's going to be easier for you to remove the calculus. But let's dive in a little bit further and start thinking about the pathology. Some pathology is embedded into the tissues. So this can help and penetrate the tissues, help with the healing component. It's drying out and desiccating the bacteria that's present, that's causing inflammation and disease in your patients. So it goes way beyond calculus. It's an amazing adjunctive therapy to start adding when we have that high pathology that's present. And she just looked at me. Okay, I just lost your sale. Sorry. But
Yeah, you did.
it's
That's the highlight. I feel like it's on us to educate people. Like, if not us, then who?
and he was like, no, everything you said is exactly right. You're missing the boat if you're using something for calculus removal. Like, we have to start thinking about the pathology that's present, which is why the salivary testing is so important. If you don't know what you're dealing with, you don't know what the treatment's going to be. What adjunctive therapies beyond scaling and root planing? Because you know what? Your instrumentation doesn't cover some stuff. So if you need to know what's going to be there, so you know what tools you might want to put in play for treatment of the patient. Or is there bacteria there? If there's not, we need to look at the systemic inflammatory issue that's causing the inflammation from the start.
Yeah, and even if you look at the data, people 65 and older, over 70% of them have some form of gum disease. So if this was truly just a surface issue, we would have solved it. Everybody knows how to scale. We can remove the tartar buildup, the calculus, but we're clearly losing that battle. So it's not a surface issue. It's something much deeper than just surfaces.
And then to take it a step further, most of those people or that population also have other diseases, other systemic problems, heart disease. Yeah. So it's connected. Of course, it's connected.
It's a cytokine problem. Back to the neutrophils.
Yeah.
And the inflammatory issue. It's about inflammation. It's not always about, yes, I absolutely want to make sure that we're reducing any pathogens that can drive inflammation. That should be our goal. But what other inflammation is going on, which is why some of the working collaboratively becomes really important. If I have a dry mouth problem, I'm going to have a problem, period. If I have someone who's mouth breathing or has sleep apnea and is just constantly inflamed, high cortisol and all of that, like I'm not sleeping, right? We're not going to heal. And we can't clear the mess to begin with. Or thyroid, right? That's going to impact mineral and transport issues and bone.
It's so important to collaborate more than we know. We recently had a patient where you had evaluated her salivary test and had given her some recommendations, and she was waiting to show her functional medicine provider those recommendations so that she can implement them. And he agreed with us and he said, green flag, go ahead, do their treatment. And when both parties are in agreement with what needs to happen with the patient, that patient is left feeling like their care is so much more for them specifically, and it's going to actually help them improve their situation.
I love that. I was working with a doctor who I thought very highly of, a dentist in my practice. And he was encouraging me to go on to dental school. And he would talk to me all the time. He's like, you should go on. You clearly are like good at what you do. Why not go on to dental school? And I was like, I don't want to be on that side of the disease. I don't want to have to fix those problems that I could prevent if you would just let me, ADA. But yeah, it was just like, that's a perspective though, is for so many people, hygienists can only do so much to impact health. And it's no, we truly can do so much more, especially with autonomy, like other states are showing, to be able to have this impact. And I think the collaboration model is so powerful. Just everything that you said, being able to provide such unique, comprehensive care for patients is the goal, right? That's how you want to be treated as a patient. You want to know that you're getting the best and you want to be able to see measurable outcomes. And that's what testing does.
Providers can agree on the same treatment. Wow.
Yeah.
That's
That's confidence in both.
Yes.
So,
super cool.
I have a question for you. As I start working with different types of practitioners and training and getting them to understand, I'm noticing I do get the pushback from some of the dentists. How am I going to get them to retest? I'm like, that's your messaging. Like, doctors retest. I have to have my thyroid retested because I need to know where my medication's going. It has to be the same mindset. Like, testing and retesting helps us understand the workflow of what we're doing to treat you, whether that's ends up being airway, right? Or working with a GI specialist. I prefer more like the functional. But have you found that dentistry is starting to pick up that, or is there other fields that you are catering more education to that are growing that a little bit more? I feel like I'm still fighting dentistry a little bit, even though we have so many different practices that are starting to pick it up. But it gets really exciting to see some of the functional doctors that are really looking at the mouth and they can't ignore it after a little while. Where are you, like, in a different group? You're in a different space than I am. What are you finding?
I think it's mirroring what you're seeing too. We do have a really great group of functional physicians, dietitians, health coaches, Eastern medicine doctors that are really open to bringing the mouth back to the body. Some dentists are, but I think the pushback with dentists is they just don't know what to do with that information. And so that's where we want to spread that education, because I feel like they would be more open to it if they knew what to do about it. And,
They could confidently recommend things and confidently say, when we retest you, given all these variables, we should see some improvement or shouldn't for whatever reason. I think that's a big part of it, like you said.
yeah, but I think the time is right. Patients are smart. There's AIs out there. There's the web. There's lots of sources of information that patients can look up and say, hey, what's causing this or whatever. And they should be demanding that from their practitioners as well. Hey, this is what I'm seeing. This is what I see. This is what I'm seeing in my body. This is what I see online. Can you confirm it? Can you help me figure out, is this truly what I have? Or am I just being crazy, thinking I have everything? I'm dying off the internet. But it's really interesting because those types of conversations open the door to, okay, let's have a more serious conversation about what this bleeding actually means. Or I'd love it if you didn't have to come to my office every 3 months. Let's get you on a track where, it's your inflammation's under control and you can employ these different things that you can do at home to keep that inflammation down. And I'm a big proponent. If we can do everything through diet, or as much as we can through diet, let's do that. Because it's not going to just affect your mouth. It affects everything else. Like you were saying, your airway, your breathing, your sleeping, your just every aspect of your life.
So I think functional medicine providers are more open to the idea as well, because I think they're just used to the testing more. And I think that also is like a big hurdle for dental offices to start doing more of that diagnostics. So I think that's a big part of what's missing. In the topic of how do I get my patient to retest, I think it's important to bring the patient back into their own care as well, being open, transparent about this is not an exact science. This is not copy, paste, repeat. Every person is different. Your routine, your habits, your diet, your everything is different, even from sibling to sibling. Like everybody is their own individual. And so I think explaining to the patient and talking over that with the patient, hey, we're going to test you today. And in 3 months, we're going to need another test. Or in 6 months, we will do another test, or we want to see at least one test every year. A lot of the times I feel like the patient, especially in the dental world, they leave the office confused. They don't know what those numbers are that they call out. They don't know what all this jargon is, and they just leave knowing that they have to floss more, I think. And being very direct and honest and open and bringing them part into the conversation is probably one of the most important ways that we get case acceptance.
Yeah. And usually what I do is I set the patient up expecting that there is going to be some sort of follow-up test, whatever that timeline looks like. And patients usually look forward to that because they want to know that whatever protocols we're recommending, that they are going to see the results.
Or if they fell off.
Yeah, or if they fell off, or maybe they're not seeing the results that we expected, then great, we can pivot and try something else. But it's really motivating when you do see those improvements. Patients are excited and a lot of times will request testing again subsequently.
Yeah, so it's just being able to offer it. We even have patients that are just curious and they say, hey, I'm curious about trying oil pulling. Can I try oil pulling, come back and do a test in a few months, see if that works? Sure, why not? Like everybody can find their own tools. Whatever the best tools, whatever's going to keep you consistent, right? So even those curious patients are fun to test as well.
And sometimes, like you said, there's no science. Like we weren't taught how to manipulate the oral microbiome. So when someone calls in like, how do I get rid of this bacteria? I can look up different research articles and look up for botanicals that we might want to include, which is something I do all the time because I'm more like, I think in your category as being not, I'll lean on antibiotics. I think that just causes antibiotic resistance. I think it causes some GI issues, and sometimes it doesn't work always. Sometimes it can be a great tool in the kit. It's short term. So we really have to figure out like what's the best way to change the terrain. Do we have a dry mouth issue? Are we addressing what's going on? I remember a husband and wife team, and they had very similar biomes. I put them on very similar care plans, but one moved much nicer than the other. It's because they're two different people. And we still had to work on one and get to the root causes. What's causing the terrain to be so challenging? And that's the benefit of testing and retesting is we have to be able to pivot, like you said. It's not failure when we don't get the results we wanted. It means we have to rethink the patient and find out what we need to address to get them to improve. Yeah. It's way beyond dropping probes. I kind of joke. In the bristle training, I have a little workflow, and like preventative dentistry looks at bleeding, bone loss, and healthy tissue.
Yeah, if you have bone loss, that's no longer
reacting to disease.
It's not dentistry.
It's reactionary. It's not preventative. If we test and really look at mouth breathing and gut and the health history and bringing that into the picture, we can be preventative long term.
On that end as well, something that just came to my mind is a lot of the times, and this is do patients see these videos? Are these podcasts for patients as well? Okay, so
if they subscribe.
Okay, you're a patient out there. Tell your dental provider about everything that is going on systemically in your body. A lot of the times we get patients that come in and we ask them, have there been any updates to your health? And they say, nothing that pertains to my mouth, and they move on. And so a lot of the times they don't disclose these underlying issues that you have to dig a little deeper for, but they just immediately think it doesn't have anything to do with my mouth. So I'm just not even going to tell my dentist about my hormones or my stool test or whatever. I think it's very important. That's a huge takeaway, is to talk about it all with your dentist as well and your hygienist.
And where you are in menopause and perimenopause, and are you on birth control or not on birth control? Like back to
What's
the
your step like?
It's
Yeah.
all important.
yeah. Are your cycles normal? I know that sounds weird too, but if you we could have some hormone imbalances that are impacting.
Right. Some of these bacteria are even detected in the placenta in preterm birth. So that it's more connected than
Pregnancy. And
Yeah.
sometimes they're the first ones to know. I've had several patients, they're like, we haven't told anybody. I was like, I promise I won't say anything to anybody. But that sometimes we're the first ones to know about some of those things. And it's very preventative to do a salivary test. You could prevent miscarriage.
Yeah, totally. And I feel like we're just going to continue to discover more and more about how really truly interconnected everything is.
What have you found as protocols? You guys are working on different protocols. Like, what are some of the key things that you're finding are helping to assist? Because going from, okay, now we're testing. So what am I going to do with the test? I know what I try to work through. I don't lean on antibiotics, which makes it a little bit unique. Bristol tends to be more conservative on the antibiotic regimen. Other testing, it's just a blanketed antibiotic recommendation. I don't lean that way. I'm being part of the IOMT too. I look at botanicals and different things that we can pull in, or ozone, and try to teach. But what are you finding as protocols that are working for you?
I guess it depends on what we're testing for or what we're specifically treating. But if we're talking about periodontal disease or gingivitis, we've been focusing, or microbial oral dysbiosis, we've been really working with bacillus spore-based probiotics. And so there's a lot of probiotics out there on the market that are for dental health or whatever, and a lot of them are marketed either to caries prevention, or they are lacto or bifido strains. And when I was using them, I felt like they were okay. I don't feel like there was anything like really life changing. But what changed for us when we started using the spores was we were getting dramatic decreases in bleeding and probing, dramatic decreases in clinical evidence of inflammation, in pocket depths. And so we wound up doing our own research study on that. It was a small case study, or case series. And we were able to not only reproduce that clinically with our patients, but also in our study. And so that was really exciting for us. And I think one of the reasons why the bacillus spores work differently is because they can survive our hot body temperature, they can survive our stomach acid, and still get to the through the GI tract and be able to do what they're supposed to do. It's not this kill everything kind of model. It's more, we're going to modulate the entire microbiome to be more symbiotic, and we can decrease inflammation overall. What happens when we put just like lacto or bifido strains in, we're putting them into an environment where they're already inflamed. So if you're putting more of these bacteria into an inflamed state where they can't survive, I don't know if it's really a waste of money or not, but we want to use something that can survive and be able to change that environment to produce the effect that we want. And we were really seeing that a lot with the bacillus spores. There's not a ton of research out there about them, but that's one of the reasons why we wanted to do our case series, so we can push more research in that direction.
So let's break that down just a little bit easier, because I definitely have had lots of probiotic conversations. Let's talk about the different strands in different products and what the bacillus groupings are. I know what you're talking about, microbiome labs. Correct. What product in microbiome labs are you utilizing to help reduce inflammation?
So we, in our
myriad.
they have a lot of different products that we use, but specifically in the case study we used, it's called Megaspore Biotic. So it's a combination strain of bacillus spores and A258. So they have competitive inhibition. So they're going to try to take up more space, crowd out the bad guys. They're going to produce antimicrobial compounds. change that environment. There's some biofilm disruption that the bacillus spores do, and also immune modulation. And so that's what made it. I don't even remember how we stumbled upon them when I was trying to figure this out. Like, how do we get these red pathogens down
Without antibiotics.
without
Yeah.
antibiotics? And somehow I came across them, and it was really a game changer for us. And I feel like it'd be a game changer for a lot of people. That's not to say that everybody needs these or spores, or it's going to
Need them forever.
produce the same effects in every single person, because there are certain patients that you have to be careful with when you're introducing new bacteria. And
The
some
SIBO
you need-
patient.
Yeah, specifically.
SIBO patients, you do have to be very careful making sure you're communicating with your patient, but just generally they are considered safe.
Versus many of the dental related ones on the market, like Bristol has one. They have 6 strands: Lactobacillus plantarum, Streptococcus cerevisiaris, Lactobacillus rudii. BioGaia has Lactobacillus rudii in 3 different strands that they have on their blend. There's Burst. So have you tried those? And have you sometimes what I use them for is some of those should be naturally in there anyways. So if I have a low beneficial score, I'm using those to build the beneficials up with some of those. So I like using those for that purpose. And they do have some science behind the bacteriocin quality, but I'm super interested in what you're finding with because obviously microbiome labs very pro for the functional doctors. I have that strand that if I walk into my naturopaths, or even it's very common on the systemic side of things. And I know Dr. Taylor, if you listen to her podcast, talks about the benefits of the microbiome lab one too. I'm going to have to start putting that in my care plan.
Yeah, you guys can join us this year in Nashville. We'll be keynote speakers there. So they really are pushing to have the mouth part of the systemic conversation, which I love because they're also going to be talking about women's health and GI health and kind of the whole
Microbiome.
the whole
connecting it to the
microbiome.
body.
Yeah. There's a lot of probiotics out there that are great. Al-Ruteri is amazing for so many things.
But I feel like whenever we start to talk about the spores with patients or other practitioners we're educating, I feel like it does come back in the sense of, okay, so if I add this probiotic, what then? Do I have to take this probiotic forever? Do I have to? And I think it's like rethinking that as well, because these treatments, a big part of the reason why they exist is not just to kill that bad bacteria, right? It's to promote the good bacteria, to promote your immunity, your immune system, to be able to fight those bacteria if and when you're exposed to them, because an antibiotic, like we said already, that will eliminate this bacteria, but maybe just for a short period. And so even
our health is not static. It's going to be consistently changing.
So even with the spores, we've had questions of, so do you swish it and then you swallow it? Do you just swish it? And actually in our study, it was just taking the probiotic, swallowing it. And so it opens up this kind of idea of a lot of people really want to know what toothpaste, what rinse, what can we put in the mouth that can help improve. But I challenge that idea because since we are talking about how connected the whole body is in the mouth, then I challenge people to try to understand that what's happening systemically is going to reflect in your mouth. So yes, you can add a probiotic to the, but eventually when your saliva is produced, that's in your body. That's not just here in your mouth. So yes, oral probiotic is great, but I think it also has to involve some other systemic intervention as well.
Love it.
So is that the research that's under peer review right now? So what is the ETA? How is that process going?
I don't know.
It's a long process.
It's a long process. I thought it was going to be super easy. We're going to get it out there. That's proving to be a much longer process than I had hoped for, but before the end of the year, I would assume.
Cool. What do you plan on doing with your research?
we just want to share it with the world. I feel like this is a real big game changer for dentistry, for hygienists specifically, because hygienists want to treat their patients. The hygienists want their patients to get better. They're tired of saying patients need to floss more, but it's an easy tool that has reproducible effects and it's very safe.
And it doesn't have technically bad side effects like an antibiotic. There are things on the back end that can go amiss with that usage of antibiotics, but with probiotic usage, I feel like a lot of our patients, actually to the contrary, they will say, wow, I feel so much better. I actually didn't even know I had gut issues until I started taking these. And now that I've improved, now I can realize that maybe my body wasn't operating as optimally.
Yeah.
Yeah.
That's
So
100%.
yeah, we want to share it with the world. I think it's going to be a big game changer for hygiene, for dentistry, for patients. They're going to finally start getting the answers. And I think it opens up the wider conversation that we were talking about before, that there's more to the mouth than just bleeding and cavities.
Yeah, for sure. It's interesting because I get the same question, like, how long do we have to have people on them? And there are no long-term studies on probiotics. Like, maybe there's a year study, 6 months on like having someone on it, but then there's nothing following up on like long term. Does it stay with for that? So when people ask me, generally I call them companion plants. We're transplanting some companion plants in there to help cater the environment. They're like the marigolds and the alyssum in the garden, right? We don't have to, hopefully, if we get you in balance, hopefully we can keep you in balance and figure out what the terrain is to maintain that balance on your own is the goal, right? I love the systemic component of it. I'm definitely going to have to start looking into those a little bit more. Thank you.
Yeah, so that's usually what we tell patients is we're not trying to sell you a supplement or give you something that you want to take forever. What we really want to do is just get you through this period where your immune system can get stronger and better. That way, when you are exposed to these bacteria or viruses or whatever the case may be, that your body can naturally fight it off and take care of it.
Yeah. Patient self-efficacy is always the best place to be. So with kind of as we start to wind down our conversation, I don't know if I want to put you in a corner and say, what one thing do you wish would change, but what do you think needs to change for this to just become standard of care? Do you think it would be one thing like education in dentistry and dental hygiene, or do you think that existing practitioners just need like an aha moment? What would be your, like, I wish we could just get this to be there?
I feel like definitely exposure. That's number one, right? And being able to spread the message to as many people as possible to start to create the conversation. Because a lot of the times, and we were just talking about this yesterday, but when you hear a concept for the first time, it's so foreign sometimes that your brain has a hard time even considering it. So I think it's important to continue to talk about it, exposing patients, exposing dentists, doctors, everybody out there to the idea. But also, I think, I don't know, exposure and guidance. I think people need guidance. I think people need someone to take charge and say, I have the tools. I've seen it. Maybe I don't know everything, but I have a leg up in the race and I have some insight, because I feel like everybody's looking for an answer. There's these salivary tests and what do I do? What do I do? I think it just requires that ownership for us to be able to say, we have some knowledge and we have something to share and we can help you.
Yeah, I agree. There's a lot of hygienists out there just don't even know that there's other ways to practice than just traditional hygiene. And so I think just spreading the word, letting them know that there's more out there. It's more exciting than just what you were taught in school. And for patients too, I think just patients need to start like demanding more from their practitioners. Hey, we live in these modern times where have access to all this science, and that science shouldn't just live on the paper. Like, it should live in the clinic. And if we're applying what the research shows, then we should be able to produce those results.
Yeah. No, that's super cool. I think obviously if we're all biological hygienists here, this is a safe space, but for clinicians listening that maybe they're just starting that journey, they had that seed planted, they heard it once, they heard it twice. It can feel so overwhelming, right? When you first realize that everything that you've been taught in this safe little box from school, the lid just gets blown off. It's terrifying because you're like, oh my gosh, but like, where does it end? Like, where does it end with the possibilities? And we're not even there. It can be overwhelming for that clinician. What do you think is a good first step to take?
I would say find your passion. And I think even after I had been practicing for years and years, I didn't really know what my passion was until I found the oral microbiome, whether it's airway or it's some other modality of treatment, maybe it's ozone or whatnot. When I first heard ozone, I'm like, what the heck is ozone? And
Yeah.
is this safe? And how am I going to use it? And there were just so many questions, right? But when you actually switch that lens from what you were taught to just opening your mind and thinking about there's other possibilities, there's more than one answer, it really starts to make a lot of sense. It's actually very freeing because you're like, oh, I can actually treat my patients. I can see the really good results that they're getting, and I feel really good about it.
Yeah. And as far as starting to introduce celery testing into your practice for all those dentist doctors out there, first of all, find someone like Heather, Amanda, or the Mouth Lab. Find someone that can help guide the process. And I think a great place to start is to test one patient. That patient that has come back to you over and over again with continued decline, test them, ask them to try out a treatment. And I think from there, you open up the gates of this whole world because you can't start unless you actually start, right? And if it's with testing yourself or testing that one patient that's just has your head spinning as to why there's no improvement, start there. And I think if you do, then you will discover it, find the Mouth Lab, find anybody in your area that can do these tests for you, that can put it into simple terms and simple science to be able to connect all these things. And I think that is the best first thing that you can do.
Amen.
Totally agree.
I had a consult, a new training with an office that's been doing the testing, but they had a new hygienist, and she's I've been doing this for 24 years. COVID had me completely burnt out, and she started to cry on our call, and I was like, okay, let's just take a step back. Call me outside of Bristle. You need mentorship. Like, you are in an awesome practice that's going to teach you. She was using a phase contrast microscope in a different office. I said, you're there. You have the knowledge. You're not in a completely new environment, but let's take it in baby steps. Figure out what your learning needs are, and find a mentor that's going to help you grow in what you become passionate about, and surround yourself with those individuals. The IOMT, the IBDM, AHOSH, those are good groups to start with. There's so many different education out there and then find your posse. Look at there's plenty of Instagram stuff out there now where we can find individuals. That's how Amanda and I started this. We somehow got connected through Guru Nanda, and we were like, yeah, let's do it.
It was Noriana, but
no,
yes.
did. We started our own little oral microbe nights that we were doing for a little while, and then we were like, we should just do a podcast.
Oh, biofilm babble. That's what we called
Babble.
it. Biofilm babble.
I love that.
Yeah.
I think a lot of times that biological or holistic terminology can be scary to people because I don't want to be weird or whatever, it's woo or whatever. But I really feel it's not. It's just whole body care. It's systemic health. And that's where the mouth has always belonged. And for whatever reason, it got that terminology. And this is really the way that we should have been practicing all along. And it's not weird, but I do feel like a lot of people in the holistic biological world are very open to mentoring or answering questions. And I really do enjoy that. And I love working with everybody in the circle.
And I think just as valuable for our viewers, what can we help with? What questions do you have for us? What can help remove that roadblock into starting your salivary testing journey? I think that's really always good insight for us. We always want to know how to best help you. And so if you have any insight or any questions for us, that's definitely what we want to know.
That's a great transition. So if they want to, how do they reach out to ask those questions or get some of that mentorship?
That's awesome. No, yes, they can reach us at themouthlab.com. There we have services for both clinicians and patients. You can find us on all of our socials at The Mouth Lab everywhere, or you can email us at info@themouthlab.com, and we're happy to share any information that we have or just talk through what you think we can help with as well.
I love it. You guys have the same mission I do. It's
Love that. And I love that we found each other and that we support each other because
elevating each other, supporting each other, and letting people thrive in the space that we should be thriving in.
Yeah.
yes.
Thank you so much for having us on. This was fun.
Yeah.